Ladies and gentlemen, today we'll journey into a fascinating topic, the future of evidence-based medicine and critical appraisal. As healthcare evolves at an unprecedented pace, so do the tools, strategies, and ethical frameworks that underpin evidence-based medicine. From groundbreaking advancements in artificial intelligence to the growing emphasis on personalized care, the landscape is changing, and with it, the way we evaluate evidence and make clinical decisions. But why does this matter? Imagine a world where treatments are tailored to individual patient profiles, where guidelines are updated in real time as new data emerges, and where ethical considerations drive the responsible use of technology. This isn't science fiction. It's the direction evidence-based medicine is heading. In this tutorial, we'll explore how emerging technologies like AI and big data are reshaping evidence synthesis and critical appraisal, the evolution of clinical guidelines into dynamic, real-time resources, the rise of personalized medicine and its implications for critical appraisal, future trends, including patient-centered care and continuous learning for healthcare professionals, the ethical challenges we must navigate as we move forward. By the end of this session, you'll have a clearer understanding of the forces shaping the future of evidence-based medicine and the critical appraisal skills needed to thrive in this rapidly changing environment. Let's start with the transformative role of technology in evidence-based medicine. Advances in artificial intelligence, machine learning, and big data are revolutionizing how we generate, synthesize, and critically appraise evidence. Let's look at the role of artificial intelligence in evidence synthesis. Artificial intelligence, AI, is rapidly becoming a cornerstone of evidence-based medicine. Its ability to process vast amounts of data in a fraction of the time it would take humans is reshaping evidence synthesis. Here's how. 1. Streamlining systematic reviews. AI tools can scan thousands of studies to identify relevant evidence, saving researchers significant time. For example, platforms like Covidence and Rayan use AI algorithms to assist in study screening and data extraction. 2. Real-time evidence updates. AI enables the creation of living systematic reviews that update as new studies are published, ensuring guidelines are always based on the most current data. Imagine a researcher tasked with evaluating the effectiveness of a new diabetes medication. Instead of manually reviewing hundreds of clinical trials, they could use AI to identify high-quality studies and extract key outcomes, accelerating the appraisal process while maintaining rigor. Then we see big data and predictive analytics. Big data, characterized by its volume, variety, and velocity, is another game changer. Healthcare systems generate enormous data sets, from electronic health records, EHRs, to patient-generated health data from wearable devices. Here's why this matters. 1. Identifying trends. Big data analytics can uncover patterns that would otherwise go unnoticed, such as predicting disease outbreaks or identifying risk factors for chronic conditions. 2. Enhancing personalization. By analyzing large data sets, we can move beyond population-level evidence to more tailored interventions, ensuring treatments align with individual patient profiles. For example, big data analytics could help identify subpopulations that respond exceptionally well or poorly to a particular cancer therapy, guiding more precise treatment recommendations. Another technology is the augmented critical appraisal with technology. These technologies don't just streamline evidence synthesis, they also enhance the critical appraisal process itself. For instance, 1. Natural language processing, NLP. NLP tools can extract and summarize key findings from research articles, helping appraisers focus on evaluating study quality rather than data retrieval. 2. Bias detection algorithms. AI can flag potential biases in study design or reporting, ensuring appraisers are aware of limitations before interpreting results. While these advancements are exciting, they also introduce challenges. For instance, reliance on AI and big data requires careful oversight to ensure transparency and minimize the risk of perpetuating existing biases in healthcare. Let's have a real-world example. Using AI to improve vaccine development. During the COVID-19 pandemic, AI played a critical role in accelerating vaccine research. By analyzing genetic data and modeling potential vaccine candidates, researchers significantly shortened the development timeline. Additionally, big data analytics helped monitor vaccine safety and efficacy in real-world settings, providing critical insights for public health decisions. This demonstrates how emerging technologies are not only enhancing evidence-based medicine, but also enabling rapid, data-driven responses to global health crises. Next, let's shift our focus to the evolution of clinical guidelines and how they're becoming more dynamic in the future of evidence-based medicine. Clinical guidelines have long been a cornerstone of evidence-based medicine, serving as a roadmap for best practices in patient care. Traditionally, these guidelines were static documents updated periodically. However, as healthcare becomes more dynamic, the way we develop and use guidelines is evolving to keep pace with new evidence, technologies, and patient needs. From static to living guidelines. The term living guidelines refers to a new model where clinical recommendations are continuously updated as new data becomes available. Here's how this evolution is reshaping evidence-based medicine. Continuous updates. Unlike traditional guidelines, living guidelines integrate new evidence in real time, reducing the risk of outdated recommendations. Dynamic decision support. Integrated with electronic health record (EHR) systems, these guidelines can provide context-specific recommendations directly at the point of care. For example, in oncology, where treatment options evolve rapidly, living guidelines ensure that oncologists are always informed about the latest therapies and their effectiveness. Emerging digital tools are streamlining the development and dissemination of clinical guidelines. Let's explore how. AI-driven evidence reviews. Artificial intelligence accelerates the review of literature, ensuring faster updates without compromising quality. Interactive platforms. Digital platforms allow clinicians to access guidelines in user-friendly formats, such as interactive flowcharts or decision trees. Global collaboration. Cloud-based tools enable guideline developers worldwide to collaborate, ensuring recommendations are comprehensive and culturally relevant. For instance, platforms like MagicApp provide clinicians with interactive web-based guidelines that adapt to individual patient scenarios, offering tailored recommendations based on the latest evidence. One of the most exciting advancements is the move toward personalized guidelines, which consider individual patient factors such as genetics, comorbidities, and preferences. These personalized recommendations are powered by patient data integration, combining EHRs, genetic profiles, and patient-reported outcomes to refine treatment decisions. Adaptive algorithms. AI algorithms continuously learn and adapt to improve the accuracy of personalized guidelines. Imagine a cardiologist treating a patient with hypertension. Instead of a one-size-fits-all guideline, they receive personalized recommendations that consider the patient's genetic predisposition, lifestyle, and concurrent medications, ensuring a more precise and effective treatment plan. While living and personalized guidelines offer significant benefits, they also come with challenges. Data overload. With continuous updates, clinicians may struggle to keep up with new information. Implementation barriers. Integrating dynamic guidelines into clinical workflows requires robust infrastructure and training. Equity concerns. Ensuring that personalized guidelines are accessible to all, not just those with advanced healthcare systems, is critical. Addressing these challenges will require a collaborative effort between healthcare providers, researchers, and policymakers to maximize the impact of these evolving tools. While living and personalized guidelines offer significant benefits, they also come with challenges. Next, let's delve into the rise of personalized medicine and explore how it's shaping the future of evidence-based medicine and critical appraisal. Personalized medicine represents a paradigm shift in healthcare, moving from a one-size-fits-all approach to treatments tailored to individual patients. This evolution is transforming evidence-based medicine by demanding more nuanced critical appraisal methods that account for variability among patients. Personalized medicine involves using detailed patient information, such as genetics, lifestyle, and environment, to develop targeted treatments and care plans. Unlike traditional evidence-based medicine, which often generalizes findings from population-level data, personalized medicine recognizes that every patient is unique. Let's break this down with an example. Imagine two patients diagnosed with the same type of breast cancer. Based on genetic testing, one patient might respond well to a specific therapy targeting a genetic mutation, while the other might require a completely different treatment plan. Personalized medicine ensures that both patients receive the most effective care for their individual profiles. Personalized medicine doesn't diminish the importance of evidence-based medicine. It enhances it. Critical appraisal now needs to go deeper, evaluating studies not just for population-level effectiveness, but also for subgroup analyses. Here's what this entails. Subgroup analyses. Researchers must examine how interventions perform across different demographic, genetic, or clinical subgroups. Precision of evidence. Appraisers must assess whether evidence supports personalized recommendations, such as pharmacogenomics or tailored lifestyle interventions. Long-term outcomes. With treatments tailored to individuals, appraisers need to evaluate how these approaches affect outcomes over extended periods. For instance, when appraising a study on a cancer therapy, it's crucial to assess whether the study included genetic testing and whether the results were stratified by genetic variations. The rise of personalized medicine is powered by cutting-edge technologies that generate and analyze patient-specific data. Key examples include genomics. Advances in genomic sequencing allow clinicians to identify genetic markers associated with disease risk or treatment response. Wearable devices, fitness trackers, and health monitors provide real-time data on patient activity, heart rate, and more, offering insights for tailored care. Artificial intelligence. AI algorithms analyze large data sets to identify patterns that inform personalized treatment decisions. Consider diabetes management. A wearable device might track a patient's glucose levels in real time, while AI analyzes the data to recommend adjustments to their diet or medication, creating a highly personalized care plan. While the potential of personalized medicine is immense, it also raises important ethical questions. Data privacy. With large volumes of personal data required, ensuring its security and confidentiality is paramount. Equity. Personalized medicine risks widening healthcare disparities if access to advanced diagnostics and treatments is limited to high-income populations. Informed consent. Patients must fully understand how their data will be used and the implications of personalized treatments. Addressing these challenges will be essential to ensuring personalized medicine is both ethical and equitable. Real-world example: pharmacogenomics in mental health. In mental health treatment, personalized medicine is already making strides. Pharmacogenomic testing helps identify how patients metabolize antidepressants, allowing clinicians to prescribe the most effective medication with the least side effects. This approach has significantly reduced trial and error prescribing, improving patient outcomes and satisfaction. Personalized medicine is undoubtedly shaping the future of evidence-based practice. But as it evolves, healthcare professionals must adapt their critical appraisal skills to navigate its complexities effectively. Next, let's turn our attention to future trends and innovations that will continue to redefine evidence-based medicine. As we look ahead, evidence-based medicine is poised to evolve further, driven by advancements in technology, changing patient expectations, and global healthcare challenges. These future trends promise to reshape how we generate, evaluate, and apply evidence to improve patient care and outcomes. 1. Patient-centered care and shared decision-making. Healthcare is shifting from a provider-centric model to one that places patients at the heart of decision-making. Evidence-based medicine will increasingly emphasize incorporating patient values. Treatment decisions will align not only with clinical evidence, but also with individual patient preferences, beliefs, and circumstances. Interactive tools. Decision aids, such as mobile apps, will help patients understand evidence and actively participate in their care plans. For example, in oncology, shared decision-making tools can help patients weigh the risks and benefits of different treatment options, considering both survival rates and quality of life. 2. Real-time evidence generation. The traditional cycle of evidence generation and guideline development is giving way to more dynamic processes. Key innovations include living systematic reviews. As discussed earlier, these reviews update continuously, incorporating new data to provide real-time insights. Adaptive clinical trials. These trials allow modifications to protocols based on interim results, making them faster and more efficient. For instance, during public health emergencies like pandemics, real-time evidence generation can guide immediate responses while longer-term studies continue in parallel. 3. The integration of big data and AI. Big data and AI are no longer just tools for research. They are becoming integral to everyday clinical decision-making. Emerging applications include predictive analytics. AI models predict patient outcomes based on historical data, enabling early interventions. Personalized clinical guidelines. AI adapts broad evidence-based recommendations into patient-specific guidance. Imagine a cardiologist receiving AI-driven alerts about a patient's worsening condition based on real-time monitoring, prompting timely adjustments to the treatment plan. 4. Global collaboration in evidence-based medicine. Global health challenges, such as pandemics and climate change, require collaborative efforts in evidence generation and dissemination. Future trends include multinational clinical trials, expanding research to include diverse populations for more generalizable results. Open access data, sharing research data globally to accelerate discoveries and ensure equitable access to evidence. An example is the international collaboration on COVID-19 vaccine trials, which included diverse populations to ensure broad applicability of results. 5. Continuous learning for healthcare professionals. The pace of change in evidence-based medicine means healthcare professionals must embrace lifelong learning. Future trends in education include micro-learning platforms, short targeted lessons delivered via apps or online platforms, keeping clinicians updated on the latest evidence. Simulation training, virtual reality and augmented reality technologies will allow practitioners to practice applying evidence in realistic scenarios. For example, a surgeon might use a VR simulation to refine techniques for a new, evidence-based procedure before applying it in practice. While these innovations offer exciting possibilities, they also bring challenges. Data privacy and security, protecting patient information as data sharing and AI integration expand. Equity in access, ensuring that advances in evidence-based medicine benefit all populations, not just those in high-resource settings. Bias in AI, addressing biases in algorithms to prevent perpetuating health disparities. These considerations must remain central as we navigate the future of evidence-based medicine, ensuring progress is both ethical and equitable. So, as we've explored, the future of evidence-based medicine is dynamic, inclusive, and deeply connected to emerging technologies and global collaboration. From personalized medicine to real-time evidence updates, the possibilities are immense. But with these advancements comes the responsibility to critically appraise and apply evidence in ways that are both ethical and impactful. Remember, evidence-based medicine isn't just about following guidelines. It's about adapting to new realities, embracing innovation, and putting patients first. Together, we can shape a future where evidence-based medicine improves health outcomes for everyone, everywhere. Thank you for joining me in this exploration. Stay curious, stay informed, and let's continue to advance evidence-based medicine together. See you soon in the next tutorial, and thank you again.